burning question that you want to ask me, you can stop me. But if we can do questions at the end, it might just be better because the presentation may cover some questions that you might want to ask me. Okay, so are we ready to start? Okay, so I'm Dr. Harshna Bijlani. That's the name of my clinic in Mumbai. We have 3 centers. I'm going to quickly go through what I think is our problem in India, which is hopefully changing, is that we spend a lot of money on our jewelry, a lot of money on our clothes, but not on ourselves. And I mean brides, parents, everybody. But it is changing, and I think that's great. So we have to look good. It doesn't matter if you plaster makeup on, but if you have, your skin is not fresh or not glowing, no makeup is going to make you look good. Okay, this is a little bit of my degrees. These are some of the people who we cater to. Okay, so when to start? So I always get this question, when is a good time? I'm getting married in December, I'm getting married in Jan, when should I start? So it depends what it is that we're looking for. If we're looking at laser, for example, good time to start is 7 to 9 months because it takes so many sessions. It's not a one-session job. But if you're living in the same country or the same city, where you've started your laser, you can continue after laser. You don't have to finish all your sessions before. Acne scars, pigmentation, none of these things are a one-session job. So please start earlier, plan earlier, go to your doctor, figure out what it is that you need and plan your sessions. Don't waste time and then 1 month before get up and think your scars are going to go. Okay? But having said that, let's say you do have a month, last minute runaway wedding, or just you don't have the time, other priorities. There are still things you can do a month before, so then don't give up and say, I'll just plaster makeup and go. There are things you can do. This is really important. How do you pick a good doctor and how do you pick a good clinic? There's so many clinics, so many doctors. My friend goes to her, my friend goes to him. She's good, he's good. How do I know? So don't go by advertising alone. Do your homework. Friends and family, best way is word of mouth. I think in our field, it's word of mouth. If somebody said, I think she's good, she's done wonders to my skin, more likely than not, she or he might be more suitable to you than just seeing an ad in the newspaper and running to that clinic because they're having an offer or a discount. Okay? It's your skin you're talking about. Listen to what they have to say. Go meet a couple of doctors. Feel the connection. Feel that you think this person understands your skin, and then you can decide what it is that you want to do. What kind of technology are people using? It's really important. When I ask my patients come to me and say, but doctor, I've done 5 sessions of laser. I'm using laser as an example because most of us are familiar with laser hair reduction. And then I ask them, okay, so what machine have you used? And they sort of stare at me blankly because they have no idea what machine they used. They'll say the one that goes tick, 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 tick. Well, all lasers go tick, 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 tick. So which one is it? It's really important for you people to know, do your homework, and maybe another clinic may have a better technology, a better machine that may suit you better, okay? How do you evaluate a bridal package? There's so many bridal packages everywhere. How do you know that one particular package is better than another package? So everyone has individual issues. One size fits all packages I find usually don't work. So if there's one package that has X amount of facials, X amount of laser lightening, X amount of whatever, we may not have the same problems. I may have more scars. Somebody else may have more pigmentation, so I may need more treatments for that. Somebody else may need more treatments for this. Okay? So try not to do a one-size-fit-all unless you have great skin and you just want that, little facial or polishing or something just to look better. So you need to make sure the package suits your problem and your skin type. Does anybody want to know about lasers or do you want me to skip this session? No, yeah? Okay. So is that a question that any of us are worried about? Or are we all pretty okay with lasers? Like, they're safe, they're okay?
I don't even know what it is.
Okay. Yeah. So have you heard of a laser?
I have.
Okay, so what is laser? Laser's been around for 20 to 30 to 40 years. Everything today in medical technology is done with laser. So whether I want to do my eyes, so people say, oh doctor, I'm very scared of laser, I think it causes cancer. But I just did my LASIK surgery 3 months ago. What do you think that was? It's a laser, okay? So lasers for eye surgeries, laser for gallbladder stone removal, lasers for renal stone, it's all lasers. So lasers are very safe, been around for a very long time. Skin-related lasers are only so many millimeters deep under the skin. It's not reaching your brain, it's not reaching your kidneys, your ovaries. When I tell people that, when I talk to brides about bikini lasers, that's really important, okay? You need to be clean. So when I talk about bikini laser, they said, oh, but I haven't had children yet. Is it okay for me to do a bikini laser? Yes, it is. It's only a few millimeters. So it's fine. Nanometers, not even millimeters. It's okay. Your ovaries are well protected. Your uterus is well protected. Don't worry about it. So last few decades evolved a lot, but there are many lasers in the market today from all over the world, okay? Many Korean machines, Chinese machines, Taiwanese, US, Israeli, whatever. How do you know a laser is good? It is if it's US FDA approved. What is the meaning of US FDA? Today, for me to launch a laser into the market, it has to have that approval that it's been through all the rigorous screening, that it's not going to burn the skin, it's not going to suddenly shoot off somewhere else where it's not supposed to. So US FDA is really important, okay? And who's doing it? Are they trained? Okay, this I thought is a little bit as an information for y'all, because there's so many lasers. How do you know what is for pigmentation, what is for scars, what is for hair reduction? So that's a little bit of you know, the technology. So if you go to somebody and you say, look, I'm interested in this, they'll say, I have a diode laser, so you'll know what it is, okay?
So more of these lasers, the diode and the NDER, I'm undergoing laser treatment for hair reduction. And they've just come up with some laser which has gas technology. So they put a bead and then there's some gas that infuses in the skin.
So maybe the gas is cool. Is it cold? It's like cold air. So that's just to prevent burns. But it depends what technology it is. So diode and Nd:YAG are, yeah, so diode and Nd:YAG are very good lasers. The nanometers is different, so the depth is different. But in our skin, diode and Nd:YAG is very good in terms of the hair reduction facility that it has. But if you use a diode, it has to be done with very skilled people, because the chances of burns with diode is a little bit more than an Nd:YAG.
NDER is preferably more
Safer. And it also depends on the technology. There are some which are tick, 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 tick. That's more old-fashioned. There are one that are tick, 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 tick. That is, yeah, so that's good. Because that is, yeah, so they're probably being more precautious that it doesn't burn your skin. As long as the technology is these, it's okay if it's with air, with gas, with whatever, it's fine.
And what's under the pigmentation and the scars technology?
So you have, mainly most people use CO2 lasers, okay? So they are the ones that burn the skin. They tell you to sit at home for 3 to 4 days, don't go out in the sun. But they're very aggressive lasers on our skin types. You better make sure that when they tell you to sit at home, you sit at home. If you're the kind of person who has to go to work, has to shop, has to do whatever, be careful of CO2 lasers. They can cause burns, okay? So you're going there to get one thing better, and you may have marks because of burns that you've had. Yeah, so for the scars, so when I say scars, there are two types of scars, okay? One are the khaddas, the pits, the pitted scars, and one are the dark colored, the pigmentation scars, okay? So when I say scars here, it's the pits. Pigmentation is your acne scars, which are dark color, okay?
How do you address the pores? I mean, are the pores...
There are amazing treatments for the pores, and you can actually reduce it by a good 70 to 80%. I'm not saying anything is 100%, especially open pores, but there was a time when we used to say, look, we can't help you, now we can. We can do a lot for open pores. It's great technology. Yeah, so there are many lasers. There's, I'm going to talk later about it, so I'll answer that question.
Does the Nd:YAG or any of these lasers remove melasma now?
Melasma is the most controversial thing in our field. Every conference I go to, there's a huge talk on melasma, and at the end of it, you've seen some ladies after pregnancy or during menopause, they have like a butterfly-shaped rash, brown color rash around this area. If you haven't seen it, it's good. But it's something which is not curable. It is treatable. You can lighten it. But the minute you go on a sun holiday and you don't take care, it's back.
No, but even in this Delhi sun, even if you're putting, this
Yeah.
sunblock all the time, you still get freckles kind of.
Yeah.
Not melasma, but...
Yeah, so I'm going to talk about sunscreen because that's the most important thing. So I'll come to that and I'll address your question at that time, okay? So does laser hair reduction really work? I think we've covered laser hair reduction, but it is reduction, okay? It's not permanent removal. So I've had patients who say, but I still have a little hair. Yes, it's reduction. It's not 100% that your hair will never come back again. It'll be finer and hopefully not as much.
So the reduction will be like, they will get lighter and more like each month kind of thing, right?
Yes. So the two things that happen, either it becomes very fine, or in some areas you won't have hair at all. So especially legs responds the best, no hair at all. Face, it depends. There are some people who it completely goes, and there are some people who have that little peach fuzz, which they bleach after that. From thick hairs become peach fuzz, so they can live with that. And in some people who have hormonal issues, they will need to do a session every 3 months. Don't think 7 sessions means 7 sessions, I'm done, and doctor, look, but my hair is still there. But you have PCOD, you have a hormonal issue, you're going to need a maintenance session. No, you need a maintenance session. But say you don't do a maintenance session in a year, you might find that I was much better then, and look at me now. It's kind of back. Okay. I thought let's talk about PCOD. Do you want me to talk about PCOD, or do you feel like, yeah? Okay, any questions that you want to ask me before I talk about it? Okay, I'm going to ask you a question. How many girls today have PCOD?
At least 70%.
Okay, that's amazingly high. But it seems like it. I know. It seems.
So many girls.
Yes.
Like young girls as well as
Yes. Yes. So it up to a couple of years ago, it was 1 in 3. I'm sure now it's much more than that. Okay, so what is this PCOD, and where the hell did this PCOD come from? So it can range. So when I have a girl, a skinny girl with regular period who comes to me saying I have acne, and when I tell her, look, you're 25, you should not have acne, let's do your hormonal test. But my periods are regular, and I'm sure I don't have PCOD. How do you know? The only way that you know you have PCOD or not is a sonography, and that is it. No blood test, no looking at you, palpating you is going to tell me if you have PCOD or not. It's a sonography. And please do a sonography just when you finish your period. Don't do it before your next period. That will throw the sonologist off. Okay? So it can be a skinny girl with a little bit of acne, a little bit of thinning hair, to a very obese girl who has no periods and like full beard, and many in between. Okay? So it's not a stereotype. I can't look at you and say, unless you have clear enough features, I may not be able to know that you have PCOD. Okay? So the only way that we know it is a sonography.
Why?
Yeah, please go. A girl told me that she went for sonography and they weren't able to detect PCOD. She went through it again and then they said that you will.
Yes. Now tell me the 2 reasons why that will happen. Firstly is when I'm doing it, it depends on my skill, that I can see your ovaries and I can see those tiny little cysts. What does it mean of polycystic? Polycyst. Poly is many. Cysts are tiny little bubbles. So I have so many bubbles in my ovaries, but I should be able to see them. What if my bladder is not full properly and I can't see the ovaries that well? Number 1. What if I went the wrong time in my cycle? Number 2. Number 3, what if I wasn't stressed that time when I went, and suddenly the next 3 months I've had so much stress and suddenly my PCOD is acted up? So it's possible. The only way, if you really want to diagnose PCOD, and I have done it for some of my patients, but not the unsexual active ones, is to do a vaginal sonography. And that is the only way, but it's unappealing for most people. And you know, we don't necessarily need a diagnosis sometimes, but that is the only way that you'll know, because it's so close to the ovaries that you can't miss it ever.
So why do you specifically suggest right after the periods? I mean,
Because before your periods, you may have natural cysts with ovulation. So that may throw the sonologist and think that that natural ovulation cyst is a polycystic ovary pattern. So better do it after your periods, like after your 5th, 6th day, you can do your. It's a better time to do it.
what do you suggest for hair thinning?
I will. I'll come to that. Okay, so essentially, if you have any of these, maybe just think about getting yourself checked. Okay. What's the treatment of it? Obviously depends on what it is and what your symptoms are, whatever. But a few tips that I'd like to give you is just avoid excess sugar, okay? It's now linked to PCOD. So sugar, just get it out of your diet. Now sugar, I don't mean by sugar. I mean by sugar in breads, sugar in pastries, sugar in whatever that has that extra sugar that you have no idea. Biscuits, all sugar. If you look up and you read the back, you'll be shocked how many things have sugar in today's day and age. And maybe that's why more and more people are having PCOD, because they're not realizing there's sugar in everything. Fructose sugar, your syrup, your soya sauce, your ketchup, all has sugar.
Even there was a healthy snack, and I looked at the ingredients pack and it was added sugar.
It has to be, because that's the only thing that's going to make it sweet. Today your lemon, your drinks that you get, it's all sugar. Find one without sugar, you'll find less takers, and the shop will probably stop keeping it because it's going to be too bitter, too unpalatable. Okay? And exercise. please, it's very important. You don't have to be, you know, obese or overweight to exercise in PCOD. Even if you're thin, you have to keep yourself fit. I don't mean exercise means go to the gym. It could be a walk, it could be a dance class, Zumba, whatever, but move your body. I thought of talking about new types of facials because I'm sure everyone knows about facials per se. So what are the new facials? Has anyone heard of any new types of facials? So nowadays, luckily in India, we have certain technology which combines 5 things in one. So instead of having that regular cleanup, pack, massage, you have a machine that does a little polishing, a little bit of a peel, a little bit of tightening, lifting, lightening, all in your 1-hour treatment. So you're getting more money, more work for your money. And number 2, you're not wasting so much time coming 20 times to that doctor doing 20 different treatments. So maybe try it. Okay? It might sound a little more expensive than a regular facial, but see how much it's doing for you, and then hence you have to cut down your session. So in a way, it's more cost effective. So they blend technology with nutraceuticals. So these are some of the names. I love the vampire facial, even though it sounds scary, but it's amazing. Does anybody know about vampire facials and what it is? Surely you must have heard of it because some of you looked at me and smiled. So what does it mean? Does it mean I'm really a vampire? No idea? Yeah. So what I love it for is, let's say I fall down and I get a graze. How is it healed by the next morning? I've not stitched it. I've not done anything. I've just put some soframycin or whatever. How is it healed by the next day? Yeah, so our platelets, they are the most beautiful thing to heal. So when I take your platelets from your blood, like a regular blood test, and I put it wherever I want it to heal, it thinks I need to heal. So if I put it in the face, it thinks it needs to heal the collagen and the scar. If I put it on the hair for hair thinning, it says, oh, these follicles look damaged, let me heal them. And people get scared, but actually it's the safest thing. I'm only putting your own blood. What am I doing? I'm not putting anything else. We literally take your blood, remove your platelets, and put it back into you. And it's amazing. The results that we're seeing with it is phenomenal. So I'm using this for melasma with very good results, for acne scars, open pores, glow, you name it, and it's just like a miracle thing. So I think every time when I tell my patient vampire, oh, the Kim Kardashian one. Yes, the Kim Kardashian one. But the photo of hers with the vampires, like with a red face, and most people look at that photo and are petrified. It's not so much. I think they over-dramatize certain things, so it's not that scary. I was going to put that picture, but I thought I'll scare you all, so I didn't put it. Okay, so now we're doing a lot of laser facials. Okay, anyone heard of a laser facial?
Yeah, it's a lot of advertising.
Yeah. So laser facials use 2 technologies. One is a Q-switched laser, and one is IPL. Now, with the laser facial, the results are phenomenal, but only if you take care of the sun. If you're going to do a laser facial and roam around in the sun, don't do it. It can backfire and you can actually get more pigmented. Okay? So I think Jennifer Aniston does a lot of laser facials and talks about it. Are we confused or we're good? We're good, right? Great. Okay. This I thought was to just give us a little bit about what all you can do. So maybe when you go to your doctor and you want to stimulate collagen, for example, you think I'm sagging a little bit. These are the sort of technologies that they should or would suggest. Okay. And so for hydration and for reducing pigmentation and anybody wants to know about that?
Yeah.
Who wants to know about that? Yeah. Okay. So has anyone got any ideas what can be done for this beautiful glow that everyone wants? Come on. You all want to know about it. You must have read about it or... Okay, yeah. Diet, super.
Yeah, exercise.
Yeah.
Sleep well.
Yeah.
Sleep on time. Regulated
Super.
sleep
What's
pattern.
sleep on time?
Like regulated sleep pattern. Sleep by 11, wake up by 7.
Yeah. And what else? Hmm. Yeah.
And soft sleep.
So no phones in the room. What do we do? Yeah. What do you think? You're not getting the radiation. Your Wi-Fi is everywhere and it's attracted by your phone. So if you're sleeping soundly with your phone charging next to you, it's not good for you. So if you really want to calm your mind and have a good night's sleep, the phone should be in another room charging, not in front of your face. And if you want it to be in the same room, make sure it's like right there and not by your bedside. And you know what happens in the middle of the night? We kind of feel like we want to pee. Well, let me just check my messages.
Yeah.
And what happens when you start checking your messages? You're awake. And then to fall back to sleep takes... So nowadays, it's actually getting... it's like an epidemic where our youth is really suffering a lot. So are we, much older generation, but our youth even more. So the ones here, if you all have cousins, nephews, sisters, kids, just try to get them to not sleep in the same room as a cell phone, okay? It's really not good for you. Okay, so why did I put this? Okay, so we know about the sleep and exercise and everything. So you all have really said all that perfectly. But what about in terms of treatments and skincare and treatments, creams? Any idea? Sorry? Yeah, so what should they contain? What did you say? Retinol. No. So retinol is vitamin A, vitamin E is vitamin E.
Honestly, during winter, I just wash my face in the morning, like after my shower, like a little bit of juice on my face.
Yeah? But look, that may work for you because you don't have acne prone skin. Somebody with acne prone skin puts ghee and they'll start getting more breakouts. So be very careful. Okay. Sorry? Yeah. So, but that also I find depends from person to person and skin type. It's not a one size that everyone has to cleanse, tones, moisturize, right? So it varies. So, should probably be question 1. So outside, I think, inside I think we spoke about, but what I would like to say is you can actually have some supplements with antioxidants, which are really good. And right now, with the pollution, with the stress, with our food, we're not getting a lot of good stuff. Indians, I find, probably are the worst in their dietary habits because the bhindi is so beautiful green, and by the time it reaches our plate, it's almost black. So where have the oxidants from that bhindi gone? Or look, I eat sabzi every day. मैं इसका सब्जी खाती हूँ, उसका I have spinach. By the time that spinach is on your plate, it's black. So that's actually, we have no raw food in our diet. Everything's cooked to death. So if you really think that you're healthy, maybe just think again, are we really healthy? How much raw stuff are we having? If raw stuff is not possible for whatever reason, juice every morning.
What about semi-cooked? Like what juice? Like
Steam is fine. But overcooked, cooked, no. Boiled, no. Steamed. Yeah, in terms of what juice? So don't have one thing every day for the rest of your life, because that can also, so too much of one thing, remember, is never good. Do a combination, whatever's in your fridge, throw it in the juicer and have it. So you can take a little bit of celery, a little bit of tomato, a little bit of carrot. No fruits. People say, oh, I have a fruit juice every day. You're having sugar. Okay? But if you want that little bit of flavor, a little bit of sweetness, put an orange slice, put a little bit of a green apple, just a little slice of it if you cannot, you find it unpalatable. Have that. There's another talk after mine, so I'm sure you can ask her. The dietitian's going to be here. But I really tell my patients try to juice, but not the juice, the pulp. The stuff we throw away is what needs to be. You can even make a smoothie, yeah, with yogurt or almond milk. Yeah, it's fine. But what I'm saying is when you juice, it should not be the juice that gives the liquid separate and the roughage is left, which we throw behind. Okay, it has to be like you're eating the juice as opposed to drinking the juice. Okay.
I have a question here.
Yeah.
I don't know if I should ask you or a dietitian, but then a few days back I was talking to someone who's into cold press manufacturing of juices. So he advised that fresh juices that we make at home in mixie or anything, they're not healthy because when you are churning them, there's some heat involved.
Yeah.
And then oxidization.
So yes, so basically a recent fad is cold pressed. So what does that mean? What they say is that the heat of it, the way it chops the vegetable, it damages the nutrients in the vegetable, and hence cold press, which pulverizes and doesn't chop, is a better option. If you can get a cold press and you believe it, do it. But even if you get it's one of those things. It's a fad now. There's not some major research. If you actually look at some of people who are into nutrition, they believe that it's all money making to sell the cold pressed machines. Okay.
You make mixie juice at home, not the cold press.
Do the mixie juice. If you can afford a cold pressed, get a cold press. There's no harm.
There's no harm to it.
Not at all.
Alright.
Okay?
But then that is what they explain. That they said that.
No, it makes sense. But how many studies have done on it? Have they actually measured the nutrient content of a mixer versus a cold pressed?
And do they have any added sugar in the cold press?
No, no. Nothing goes extra.
That's all.
Yeah.
All healthy.
Yeah.
That's thumbs up.
Hmm.
So what about the maple juice that's become a fad, which is like apple, carrot, and beetroot? Is that good when you're doing apple?
It depends how much apple there is. So if there's quite a bit of apple, no. If there's just a slice of apple, that's fine. But like I said, don't have the same thing every time. So if you're doing a couple of days of that, then change it. Do a little bit of spinach, you know, carrot. Do something else. You don't have to do the same juice every single day. Our body doesn't need the same nutrients, right? You can get different things from different vegetables. Okay, what I thought is, in terms of the vitamins, these are really important for the skin. A, C and E, which is why we get creams of A, C and E. But we also get tablets of it. So why not take it internally and apply it externally? Crystal tomato is amazing, but it's not available in India yet. If you can get your hands on it, it is the most superb thing. It is a white tomato, but no one has seen a white tomato. But it's a white tomato extract. So it's made in the US, and you literally get clear, pristine skin by taking it. It's a supplement. So I think that's great, and you can take it like even a month or 2 months. The company says 3 months, but at the end of the day, it's not magic, okay? So if it doesn't work for you, it doesn't work for you. I love glutathione. Has anyone heard of glutathione? Oh God, it's a craze in Bombay. Everyone is doing glutathione. So glutathione is an antioxidant, which has again been used for many years, but one of its side effects is brightening the skin. So we use it for skin brightening properties, but also you feel energetic, your immune system gets boosted, you just feel good about yourself. So if you're taking a supplement, you can take it as an injection or you can take it as a tablet. So if you don't get injections, take it as a tablet. It's better than not doing anything at all.
How often you need to take it?
You can take it every day, take it for 3 months, give it a break for a couple of months. People who have kidney problems, liver problems, better avoid. But if you look up glutathione in pregnancy, it can also be taken in pregnancy. It's that safe.
Is it available over the counter?
It's available over the counter. But if you take it orally, only 10% of it is absorbed by your body. So we usually prefer IV.
But injection every day?
No, then injection gets spaced out once in 10 days or once in 2 weeks or whatever. The only thing I want to add about glutathione is it's not US FDA approved to be used for skin brightening. Okay, so that's why a lot of people may not talk about it or may not do it or may not propagate it. But it's US FDA approved for energy, cancers, Parkinson's, anything that needs your immune system to be boosted, it's US FDA approved for that. So if it's US FDA approved for that, there's no reason why you can't use it to just brighten your skin, right? Like I have a 65-year-old who comes because she just feels great when she takes it. She feels like I have the energy. So there you go. It's okay. So there are certain peels you can do, pigmentation, lightening. Okay, so what home care products can be used that at least you all can start using at home or consider using at home, okay? I'm not saying a one size fits everybody, but you can maybe look for these ingredients in your creams. Ingredients to look for: kojic acid, vitamins, that's L-ascorbic acid is vitamin C. This salicylic lactic glycolic are exfoliators. So when we exfoliate our skin on a regular basis, we find that our skin feels softer, our pigmentation gets lighter, and you can use them as face washes. Because sometimes when people put too much of the glycolic, it may become dry. Use it as a face wash. It's great. Arbutin, licorice, very safe. You can use it your whole life and you don't have to worry about it, okay? So licorice, arbutin, vitamin C, very safe combinations. You can have a face wash of glycolic and application of any of these and you're sorted. Yeah?
Are things like gluten and crystal tomato okay for all ages?
All ages. In fact, crystal tomato, the youngest, can even be 13, 14, doesn't matter. It's a tomato. It's like you're eating a tomato. So if you look at the back of it, it only says that's the only ingredient in it, there's nothing else in it. And it has very strict Singaporean regulations. So we know that the product is a very stable product. Yeah.
Collagen cream is really absorbed.
Sorry?
The hyaluronic acid collagen cream.
Yeah.
How much of it is absorbed?
So hyaluronic acid is too big a molecule to really be absorbed by our skin. But when you apply it on your skin, it absorbs moisture from the air and makes your skin feel more hydrated than a regular moisturizer. So you're not going to suddenly get, a filler-like effect if I start putting hyaluronic acid here. But I will hydrate the skin better than just using a regular moisturizer.
And collagen?
So collagen, when we say collagen for lay terms, people mean hyaluronic acid. So when they say collagen fillers, they're actually made of hyaluronic acid. Retinol, you mentioned retinol. Who mentioned retinol? Yeah, you mentioned retinol. Retinol is a fantastic product, okay? If you really want to reduce your aging, your lines, use retinol. But we also have very, very strong sun. And what does retinol do? It actually exfoliates your skin. So if you're going to use retinol and go out in the sun, you're going to become red as a beetroot and you'll start getting pigmentation that you didn't have before. So be very careful. When we say retinol, okay, so there's vitamin A, which everyone hears about. Under vitamin A, you have many subtypes. You have tretinoin, retinol, retin A, tretin A. You may have, maybe when you were younger, your dermatologist may have prescribed it for acne. So tretinoin is very strong. If you're going to use it, try using it for a couple of hours every day. Don't sleep with it overnight. Build your skin up and then start doing it overnight. Tretinoin, Trettinoin. Retinol, on the other hand, is a skin-friendly version of vitamin A. So you get really good retinol combinations now. But again, I would say use it for a couple of hours every night. Maybe if you come home from work at 7, use it from 7 to 10. Wash it off and go to sleep. If the next day your skin feels okay after 2-3 days, then start doing every alternate nights and then do it every night, okay? Because some people write it off saying, but my skin became very dry. But if you're going on a holiday, you're getting a chemical peel, please don't use it a few days. Getting laser hair reduction on your face, don't use it few days before. It'll cause burns with your lasers, okay? In fact, any cream, any salicylic face wash, glycolic, whatever, don't use a few days before your laser or your peels or any polishings or any chemical-ish treatment that you're going to do. Does anybody know about this? You seem to be quite well, versed with most things I'm talking about. So, does anybody know about steroid creams? What does it do? So, how did I chance upon this is, I had patients who came to me and said, I go to my parlor lady gave me this cream and said, I will turn white, and then they start using it, and then they actually turn white, which is why they love it, and they can't stop using it, because the minute they stop, within a week, 2, 3, 4 weeks, they again start getting their pigmentation and darkness and all back. But actually, it's a steroid. But no one's going to tell you it's a steroid, because they want you to feel that they are the most amazing people who've changed your skin, okay? So, I will urge you all to please not put anything on your face that you don't know what's in it. Are you going to eat something that a stranger gives you on a flight? So how can you put something on your face when you don't know what the ingredient is? Because she gave it to me. But what is in it? And if something happens to you, is she going to take responsibility for it? Right? We're all educated people. We now understand. So some of the names are flutivate, hydrocortisone. So these are some of the names that you may know about the tubes. But so steroids are used for your melasma question, a lot of people give steroids because initially it causes amazing results on melasma. But the minute you stop, it becomes double.
So why does melasma happen, and does it happen to every pregnant
No.
woman?
Just a handful of them. Usually melasma is either genetic, so your mom or your grandmom or your aunt may have it. It is for people who don't take care of the sun at all, who abuse their skin. And it's some sort of a hormonal change that usually precipitates it. I've had young girls who've been on the contraceptive pill for whatever reason, whether it's PCOD or they're sexually active, and have had the worst melasma. So even a contraceptive pill can do it, okay? And then again, menopause. It's a hormonal change.
Just speaking to that, like I just, if you're really covering sunspots, because I have one which is very severe.
Yeah. Does anybody want to know about acne? Or everyone seems to have pretty non-acne-ish skin over here.
I suffer with adult acne.
Okay. So you want to know about acne?
Yeah.
Okay. So apart from the obvious relaxing, exercising, sleeping, eating, if you're prone to acne, use a face wash with salicylic acid. So look at the back of it, make sure it has salicylic acid and use it. Make sure you're taking antioxidants. This kiwi extract is a new thing that's come into our market. So they liken it to an antibiotic in terms of its acne reducing ability. And make sure you see a doctor way in advance. 5 days before if you go to a doctor, it's not magic, right? So try to go, if you know you're getting it, try to go a little earlier so we can give you things to sort your skin out beforehand.
But acne surgery is it as a
The question that, so adult acne, which a lot of people are getting, is usually under few reasons why, okay? One is excessive stress. Second is incorrect products. You think you're using a cream because you saw great advertising and your friend has got great skin with it and you started using it and you suddenly start getting acne, okay? Number 4, hormonal changes. Must check your hormones, okay? And number 4 is also, I've seen patients who speak like this and there's acne all over here. Yeah. Do we clean our toilet seats every day? Do we clean our phones every day? You clean your phone every day. How many of us clean our phones every day?
No.
Yeah, so that you're like a it's amazing. But yeah, no, we don't clean our phones. So what I tell everybody is hands-free. Never talk on the phone without your hands free. First of all, you don't know what that radiation is doing to you. First, see people plaster to their phone. They're going for a walk, but that phone is plastered to the ear. So you can't even relax when you're going for a walk. So if you want to talk to whatever, you have business, you need to talk about, use the hands free. So you're not worried about any radiation or heat related acne. Sometimes that phone becomes so hot, you touch it and you're like, how did it become like a microwave so hot? So hands free.
Is there kind of what do you say? The products on the forehead. Like
Yeah, so dandruff related is possible.
That's on the chin.
Yeah, so usually chin acne is usually either so laser is another cause that you can get acne, and we're seeing more and more of that. So be careful. Try to time it and see. Plus, if I do my laser today, I'm not going to break out into acne tomorrow. I may break out into acne after 2 to 3 weeks. So laser is another thing. So try to think. I always tell everybody acne is for a reason. It just doesn't come because it feels like coming. 90% of the time, there's always a reason. 10% is, it's just one of those things. But always try to find the reason.
Is it okay to pop a pill like Zithcare or something like that?
Okay, so under pills, I have a lot of pill poppers, but it depends what pill it is. I have a lot of people who take isotretinoin. Have you heard of it?
Yeah, I have, but it has side effects.
Yeah, but people are addicted to it. So day before a function, a week before, they'll start popping it. Or there's one zit, they'll start popping it. What is it doing to your body? Do you have any idea? No idea. It's high dose vitamin A. If you fall pregnant when you take that pill, you can have a deformed baby. But people don't realize that. They take it and then they get pregnant. They're thinking of planning a baby after a month. It takes 6 months to get out of your system. So don't pill pop till you don't know what it is that you're having. But yes, an antibiotic prescribed by your doctor before, which has worked for you if you take it for a couple of days, I'm sure it's okay. I'm not sure what the ingredient in Sincare is. But you can look it up and ask me the ingredient and I'll tell you if that would work or not.
Why do we have the pimples at the back?
That is again usually hormonal, waxing, and dandruff. And diet. So I'm going to talk about acne and diet because I'm a huge believer in diet and acne.
Constipation can also be.
Yeah, I believe that. What? You find out the cause of it, and then there are certain acne reducing creams that you can do, certain tablets, certain treatments, many things.
I think it's constipation sometimes. And once
Yeah,
it's out,
it's possible.
my system is clean and my
Yeah,
back is clean.
it's possible. Does anybody want to know about this? Or no? No one's really interested in it. Yeah? Okay, so I've got 2 sections. One is for the young bride and one is for an older bride or the parents of the bride. But for a young bride, the most common thing that I see is I want little bit of bigger lips. Is what I get the most common. Yeah, it's increased nowadays. But then also I get people who say, but don't make me look like X and don't make me look like Y. Okay, so not everyone looks like X and Y. There are many ABCDs and we have no idea roaming around because they look so natural. So don't get so scared after you see one person and then think that everyone looks like that. Another common indication that I do a lot of this for is for under eyes. Most Indians are plagued with under eye grooves, which make them look under eyes look darker and more tired. It is a beautiful treatment for that if done correctly. And Botox, on the other hand, for a younger bride, is probably used to slim the face down a little bit. So people that you see with really big, broad faces, you can do a little bit of Botox to get a slimmer face. Some famous actors and actresses, you'll see suddenly their face looks a little long, suddenly looks a little square, then again it becomes long. That's usually the Botox.
What about the smile? If you get a lip filler, what if it looks like forced or something? Because that's what usually happens.
So if you do too much of anything, I think that's bad. And too much at one time is bad. If you want nice, big, luscious lips, do it over a few sessions. Just don't do it at one time suddenly, because your body has to adapt to that sudden stretching of the lips. And also remember one thing with fillers, they are dissolvable. Okay? So if you hate it, dissolve it.
So what is a filler? Is it like a natural substance or?
Yeah. So it's made of something called hyaluronic acid, which our skin thinks that it's their own. It doesn't reject. So what is the difference between a filler and Botox? Sorry, that I should have done that first.
Yeah.
What is the difference? Does anybody know the difference between a filler and Botox? No? Come on. No way.
Yeah, we are very ignorant here in Delhi.
No, I don't think so. Okay, so a filler, as the name suggests, fills. I want to fill my lips. I want to fill my laugh lines. I want to fill the grooves. I want to make a chin. That's all a filler. It's a gel. It's a gel that we inject. But nowadays, we're not injecting with multiple prick marks. We're doing it all through one prick. So it's amazing. When I do my under eye fillers for my patient, I do it only from one prick here. The full under eye filler is done. She goes out, she puts makeup, and no one will know what she's done.
It's one sitting, it's done.
One sitting is done.
How long does it last?
Usually 9 months to a year. But it depends. So let's say I put very little on your lip, and we kiss, we talk, we eat, may last for 6 to 8 months. So it depends. Under eye fillers usually last for a year and a half.
Does it pain after that?
No, no. At that time, it's a little uncomfortable, but enough numbing cream slapped on before, and you should be okay. So filler fills. What does Botox do? Yes, yes, multiple times. So let's say you did a lip filler, you are happy. After 3 months, a little bit more excited. Ooh, maybe I want a little bit more because no one's realized I've done it. So then you go back and you put a little bit more. Okay? What is Botox? So, yeah, no, not filling it up. So filling is filler. Yes, so Botox relaxes the muscles. So if I'm constantly frowning and I have 2 number 11 sat there, so that everyone thinks I'm the most strict doctor, they're not going to come to me. So what does Botox do? It relaxes a muscle. So where my muscle is I involuntarily lift my eyebrows up too much or I frown too much, it relaxes the muscle and makes me look much younger and more relaxed. Okay, so when we do Botox in the jaw, we're relaxing this muscle over here. And some people, if you touch your own cheek and you bite down, some people's muscle here is that tight and some people is not that much. If it's not that much, there's nothing much you can do. But if it's quite big and nice and juicy, then you can reduce it a little bit. So these are what you can do with Botox and fillers. And you can also use Botox for sweating. It's quite an expensive way of reducing sweating, but you can. So with this girl, we made her a little slimmer and we've done a chin filler. Can you see? But you can't make out what she's done. This is literally, we've done the treatment and taken a photograph. Her chin. With here, it's just so simple. Laugh line here, laugh line gone, and this is immediately after treatment. All you can see is 2 prick marks. So people feel very scared, think they're going to look scary, bruised, battered, bashed up. That's not the way you're going to look. This is straight after her under eye filler. I've done it and I've taken a picture because people usually don't come back until their next filler is due. Body, anybody wants to know about the body? Yeah? So what can you do for your body? Body contouring, reduction of stubborn. So there are many machines nowadays for reducing certain pockets of fat that we have. The machines work well as long as you take care. If you're not going to be strict about your diet, you're going to eat everything under the sun and not exercise, please don't waste your money and then don't blame the doctor. A machine is not magic. If a machine could do everything, no one would do plastic surgery and no one would diet and no one would do anything else. But let's say I've tried everything, I have a good diet, I exercise, but I have a little bulge here, little bit here, little bit on my bra area, sorry for the men here, but machines would work for you. Stretch marks, okay, please start working on them soon. You can't go for a stretch mark treatment 1 month before your wedding. It's not going to work, then just camouflage it with makeup. But if you have stretch marks, it's not going to go by more than 40 to 50%. Anybody says 100% is lying, cannot go. So the best thing to avoid stretch marks, what I tell my patients, is stop yo-yoing your weight. If your weight keeps going up, down, your stretch marks are just going to keep increasing. And you can do the same thing that you do on your face to your body. You can do peels, you can do microdermabrasions, you can do the same superfacials I spoke to you all about, you can do that on your body. Especially if you're wearing a backless, you're wearing a choli, you know, you're talking to somebody at the wedding that you meet and you're wearing a really nice sexy low back and it's full of like bumpy acne. It's not very attractive. So how we take so much care on choosing a right outfit, just make sure you also take care on like how your body looks and how your skin looks underneath it. Okay. Older bride, parents of the bride, any parents of the bride want to know about what they can do, not do? Should we quickly skip through this then? Okay. I'm just going to quickly skip through all of this stuff. So there are machines that can actually tighten your skin like this without an injection. And I will tell you, my youngest patient that we've done this on is 29. So people think you have to be 40 and above to do skin tightening. It's a machine, it's stimulating your own collagen. It's not going to sag more, droop more. If you need to stimulate it, you need to stimulate it. If you have lost a lot of weight, let's say, and you're 28 or 29 and you want a sharper jawline or tighter skin, you can do the machines without worrying about anything if you don't want to get yourself injected.
How long does it last?
So Ultherapy is what we use a lot in our clinic with fantastic results. It's the only US FDA approved machine to tighten. It lasts for a year and a half, one session. So pretty good. I think this is really important to cover, birth control or the contraceptive pill, for two reasons. One is a lot of people have PCOD and a lot of other issues which they need to be on it. And secondly is, I ask my young brides, have you spoken to your partner what you want to use for contraception after that? And most of them just stare back at me, aghast that I've asked them this question. It's like, oh, but we don't know and we haven't. And they look at their mothers sheepishly like, you know, what does my mother think now I'm going to be doing? So it's really important for you all to think about it, because if you want to start on the pill, most run to the gynec a month before and say, you know, I think I need to be on the pill, and the gynec starts you on a pill. But what if you break out with that pill? What are you going to do a month before your wedding? The gynec will say stop, you'll get your periods in 2 days and you'll be bleeding and your skin is broken out and a mess. So please start 3 months before. That's the best way, at least 3 months before, because if it suits you, great. If it doesn't suit you, you can stop the next month and maybe try something else. Because there are many types of pills and it's not a one pill fits everybody. And I've seen it. The so-called skin-friendly pills can also cause acne or mood swings. I've had people who come in feeling like they just cry at the drop of the hat because it's the pill, and you don't want to be crying at your wedding and crying at the drop of a hat for everything, or then throwing tantrums. So skin-friendly pill, discuss with your partner. Okay? If you have a family history of cancers, female organ-related cancers, don't take it. It's not worth the risk. Certain do's and don'ts, which I'm sure we all know. But I think visit whoever you want to go to soon. Make a plan. What are you going to do with that person? What are you going to use at home? Let's say they prescribe you a cream with the best intention and you start breaking out with that cream. So at least if you know in advance, you stop and they can swap to something else. I tell everybody you have to carry an umbrella, and that's the answer to your question. If Delhi sun, Bombay sun, it's the same. India is sunny. But I've put sunscreen and gone out in the sun. No way. Carry an umbrella. Then I have people who say, oh, but I use a scarf and dupatta. But you know how the dupatta is put? It's put like that. But the face is fully exposed to the sun. So if you need to put a dupatta, it has to be like a dacoit. Okay? Which we don't want to do. Healthy food, no crash diets. Please. I know everyone wants to fit into that amazing dress and I have to lose 2 kilos or 3 kilos or 10 kilos, and then quickly that weight is lost and the skin starts sagging and you just look more haggard and sick rather than looking nicer. Healthy food, exfoliate. Really, you must exfoliate your skin. Everybody, all of us. Whether we exfoliate with a scrub, but I'm not too much pro a scrub because sometimes the granules can be little abrasive on our skin if we have very sensitive skin or rosacea or sort of those issues. You can use an exfoliating face wash, like I said, something with glycolic, lactic, whatever.
Okay, then I'm so sorry to cut you there.
Hmm.
Rosacea, is it bad or harmful to have rosacea? Because I have rosacea.
There's nothing harmful about it, but it's a huge lifestyle change that you have to make for rosacea.
But it's like a natural red on the skin, like.
Yeah, so if it's a mild rosacea which gives you a blush-like effect, it's fine.
Yeah,
But there's nothing harmful about it. Don't worry. Hydrate your skin, really important. Okay? Don't attempt any surgery before your wedding. And we've seen a lot of horrible things happening. So if you need to do it way in advance. And don't try any new treatments, products. Somebody gives you a cream, it's amazing. You start using it 3 days before your wedding and that's it, you're finished. So just be a little sensible, okay? And don't pick at acne. Okay, so I thought let's do a myth busting challenge. Okay, no prizes, but we can still myth bust. Anybody wants to answer that?
Yes, maybe sure.
Good. Okay, so to add to this, it's raining, it's pouring outside. Do I need to put sunscreen?
Yes.
Good. What about that? I'm going to ask the lady in the black. What do you think about that? No, the one in front of you. Do you think 100 is 3 times the strength of 30? So if I put 100, am I getting more protection than you if you put 30? Very good. Yeah, so it's not, okay? The difference in terms of percentage protection between 30 and 100 is barely 3 to 4%. So now internationally, they're thinking of changing this whole 150 and 150 and 200 because it actually throws your clients off thinking that it's much more powerful than a 30. As long as you're using a 30, I think it's...
Beneficial in terms of time, like.
Yeah, so it means that you will burn later, but it's not giving you more protection at that time.
Like SPF 30 protects you for how many hours and 100 protects you for how many?
Okay, so when we say protection, it's how much time does it take you before you start burning. But the pigmentation starts the minute you step out in the sun. So I have patients who say, but I put my sunscreen and I walked out. You're still going to tan. But let's say if you and I stand out in the sun, I've got sunscreen and you don't, I may tan much less, you'll tan more, but we both are going to tan despite me having sunscreen.
When I was asking this, like if I put SPF 30 or 100, so is it like that protects me for 2 hours and that protects me for 5 hours?
So technically, yes, that it means you can be out in the sun for 30 times longer. So if I burn in 2 hours, I will burn 30 times after that, but really no one's going to be out for 60 hours. So actually the 100 doesn't make any sense. What about this? Sorry, I think I answered that already.
Yeah.
But what do you all think?
Oh, that was crazy.
Yeah, it doesn't. It protects you, sunscreen protects you from burning, not tanning.
So if your BB cream or whatever has SPF already, it's fine. Right?
What is the SPF?
SPF 30 says BB.
That's fine.
SPF 30.
Yeah.
So it's fine.
Yeah,
You
but
can't put a
but
sunscreen.
once I finish this myth busting, remind me to ask you a question on that.
So if you're saying it does not hurt you for tanning, then what's the other way we can?
Umbrella.
Okay.
Yeah. Don't sunbathe. Don't go to Goa. So I have people who are, okay, I'm going to go to Goa, doctor. What should I do? And I give them this whole long list. And they come back totally tanned. And they said, but we had to swim and it was so beautiful. And it was this, can you do some detanning? No, I can't do some magic. You should have taken care when you were there. But yes, there are things that we can do, but your tan will go irrespective whether you do anything or not. But it's just you're damaging your skin. And sometimes, once the freckles or the pigmentation starts, that's when it really hits us that I wish we had taken care earlier. You don't want things to happen and then do something about it. If you don't want, okay, so let's say for example, you don't want to, you're going on a beach, you want to be out in the sun. What can you do? What can you do? Cap or a hat? How should the hat look like? Very good. You guys are very good over here. Yeah, so big, floppy hat, which you literally pull down from the sides. If you're going to wear a cap, you're only protecting this much. You're still getting the sun from the sides. So nice, wide brimmed hat in the sun. And your sunscreen, of course. But I'm going to come to that in a bit. What about this? How often should we use the sunscreen? Once is okay in the morning. I've left home. How many times? Yeah. Every 3 hours. But it's so boring and so tedious. But, so I'll give you a tip. Let's say you are out and about and you have makeup on. You can't remove your makeup, wash your face, put sunscreen, reapply your makeup. So what do? Reapply your BB cream or reapply your compact. Nowadays you get compact with inbuilt SPF. So take a little bit of compact and plaster it on. It's like reapplying your sunscreen. Okay? So it has to be used every 3 hours. If you're in the, so let's say you're in the pool and I've just put my sunscreen, I've jumped in the pool, but my club sandwich has come, so I've got out of the pool to eat that. I've dried my face because I'm sitting and I'm eating, and I jump back in the pool. What do you think? But I put it just 15 minutes back. What do you think?
Those are washed away in the pool. And then you
I wipe, exactly. So I've wiped it off. If they say water resistant, 80 minutes, water resistant, 160 minutes, the minute you come out and you pat it dry, it's out. So you have to reapply it. What about this? Yeah. What about this? Okay, do we think acne is related to diet?
Yeah, sometimes.
Yes.
Sugar.
Yeah, sugar. What's the second thing? No, diet. What when the diet causes acne? Yeah. Good. What else?
Spicy
Yeah.
food.
Yeah. Yeah. So spicy, sugar, oily. What else?
Having too much of anything will just
So the one thing which is my pet peeve when it comes to acne is milk.
I read somewhere dairy products.
Yeah. And there's a study done on this. So I've been saying this for 10 years, but there was a study done 3 years ago.
I was having curd every day, and I didn't know. There was a supplement with this around my face, and I just tried what are the causes.
Yeah.
And there was dairy product. I stopped
Yeah.
having curd just for the
Yeah.
80 minutes to observe.
Yeah.
And it suddenly
Yeah. But curd can work for some people and not for other people. It's the milk that I have the biggest issue with. So let's quickly go through. Does anybody want to know why milk, but? So when I tell my patients, they nod their head and they say, yes, doctor. Okay, and I ask them, but why? Aren't you going to ask me why? Why are you just taking, okay, doctor ne bola, so I will stop. Why am I saying this? You question, right? Why you do something in life. It's your body. You can't just, I'm not a dictator telling you have to do it. So we get milk from the cow or a buffalo. Who does she produce milk for? Quickly. Avi, her calf. That's it. She's producing for her baby. Do you see any other mammal or animal drink another animal's milk? We are the only ones who do. Okay? So her hormones, her proteins, her everything is going to her baby, which we are having, and what is it doing to our body? And we lactate as women when we have a baby. We don't lactate our whole lives. So that cow, poor thing, why is she perennially producing milk? So yes, they keep lactating and stimulating, but there's also maybe some hormones going into that cow to keep stimulating the milk nowadays. It's become very commercial. Okay? So just be careful about that. Okay, we're almost running out of time, so I'm going to quickly sum up the hottest trends. Eyebrow revival, vampire facial, crystal tomato, ult therapy, medical facial, lip fillers. Many people are doing it now, love it. So eyebrow revival, just a quick picture. So some people, now thicker, fuller eyebrows are in. People are penciling their eyebrows. Younger girls may not have so much of an issue. It may just be like little scanty, little scanty. Some people want, some older women are starting to, eyebrows are starting to fall off because of menopause, thyroid issues, whatever. You can actually fill in your eyebrows with this technique. Okay, any question and answers?
Is there any way to get a permanent fix for under eye circles? Is there anything which you
Yeah, so then under eye circles are related to a couple of things. One is the darkness and the pigmentation under the skin. Sometimes the skin under the eyes is so thin that you can see your blood vessels underneath. That is very difficult because it's just the thinness of the skin. Sometimes it's a groove which throws the light. You can do a filler.
and the pills that you're talking
it will help. Yeah, including the glutathione. So I've had patients who've had neck pigmentation. We've given them glutathione, and the pigmentation's actually got much better. Yeah, but it's not magic. Because I've also had a handful of them who have not seen any difference. Then what happens? Then they get greedy. Then they take a higher dose and a higher dose and a higher dose, and they go elsewhere and take like some ridiculous amounts of it. Please, you know, if it's not working for you, it's not going to work for you. You don't have to take mental amounts of doses which can actually have more harm. So if you Google glutathione, there's also a lot of horror stories out there, and people get scared, but that's because people are doing crazy high doses because they're so obsessed with getting white. Okay, first of all, that obsession that we have of white skin needs to really go. But if you want to glow, these are great things to do. Okay, some people ask me how many shades lighter will I get. I can't answer that question. Okay, we're not doing some like bleaching. Both, because they're only vitamins. You can take them both. Yeah.
Which creams are better, tretinoin or retinol?
Tretinoin is too strong, I find. So younger skin, very oily, very greasy, tretinoin is okay, but not older skin. So Retino A also contains tretinoin. If it works for your skin, build it like I said. Do it 2 hours, 2 hours, 2 hours, alternate.
Concentrations available 0.02.
Yeah, so don't go for a higher percentage because also when you go out in the sun, you may actually have more sun damage because it makes the skin more susceptible to damage.
Does the Botox also give you droopy eyes? Sometimes
If too much has been given, yes, and incorrectly. So also it depends who you go to. So go to an experienced injector. So hair thinning is related to a lot of different issues, okay? Diet is really important. So you need to sort that out. Secondly is, what is the cause of the thinning? Do you have hormonal issues? Is it genetic? But now I would say my youngest patient I've seen with male pattern balding is 18. So something's happening. You know, we're getting older before our parents did. Sometimes you look at your grandmother and they still have such great skin, so much hair, and you're wondering what is happening to this current generation. So yeah, something is happening, but there are things that you can do about it. So diet, topical applications, PRP that I spoke to you about, which is taking your own blood and putting it in your hair. Great options.
Do you think
Many
yoga
things.
will make a difference because hypothyroid and all of these things are
Yeah.
there. So if you do your shoulder stand with Kapalbharati, I think that also.
Yeah, so see, I think yoga is great, and I do yoga myself, and I love it. The correct yoga is important, not power yoga and all of those things which are more fads, but it's not a cure for everything. Okay? So let's be realistic.
Do you have a solution for pigmentation on the lips?
Yeah, so there are couple of things you can do. One is you can do a lip lightening laser, and the lasers that lighten the lip, but multiple sessions are required, plus it needs maintenance. You can't do one session and think it's done. So that's one, and you get lightening creams that you can start using on the lips as well.
What about retinol?
Sorry, I'm just going to answer the question, yeah?
Which creams contain retinol?
You have a lot of brands that have it. There's a really good retinol-based cream by a company called Sesoderma, which is available in any big chemist. And Aven has them, Bioderma has them. A lot of French companies will have good creams with retinol. In Indian creams, you have something called Iga, Yugad, all contain retinol.
What about armpit?
Armpit darkening is usually much deeper than you think it is. Sometimes it's a reflection of hormonal issues going on inside the body. So you have to get it checked. It could be related to your DO, it could be related to waxing, it could be a genetic thing, hormonal. So the things you can do, but first there's always a cause, right? First make sure there's no cause, no major cause. Then you do your peels, your lightening creams, laser lightening, all that's fine. Laser hair reduction, get rid of the hair so you don't have to keep waxing, shaving.
And just actually, did you talk about sunspots? I thought if they're like already existing, how do you treat them in body?
So sunspots are usually quite, even though they're on the superficial layer, they're very difficult to get rid of. So either you do a very deep peel or you do it with a laser lightening. A Q-switch laser would lighten the sunspot. But the minute you go out in the sun, you don't take care, it's going to come back again. The freckles are going to come back again.
And is this micro peeling something for the body? Micro peeling or derma peeling?
The dermabrasion, dermabrasion is polishing. That's not really going to get rid of them.
Peeling, I believe.
Yeah, so peeling is fine. Yeah, but you'll need multiple sessions. Okay, I'll just take a last question. Does anyone have any burning question?
Applied under the eye.
Yes, always.
So sometimes
Space.
they don't
Oh yes, I told you I want to know. How much sunscreen should we use? Last thing, and then we're wrapping up. How much sunscreen should we use? This much, that much? No, tell me amount. Peanut sized amount for the full face and neck. Coin sized amount. Yeah. Anything else? Yeah, but how much are you taking?
Like a drop size. No measurement.
Half a tablespoon. Yes. So what we all are doing and thinking we're putting sunscreen on our face is actually all incorrect. Yeah, but then you put a sunscreen under your BB cream. Yeah. If you're not going to put so much BB cream and look weird, put a sunscreen and put that on top.
Keep dropping so much.
Yeah, so what you do is you take it and you pat. And if you find that particular sunscreen too heavy and greasy, find sunscreens which are gel based, find sunscreens which are matte. Do your homework.
Any particular brand?
Yeah, so Bioderma does a matte sunscreen. If you travel abroad, Kula is fantastic. It is all organic and it's beautiful, the sunscreen. Kula, Coola. It's an American brand. It's literally farm to face.
Which is the Indian one?
Indian one is La Shield. It's pretty good. It's a gel-based sunscreen.
So
La
that is
Shield.
also we have to use half a tablespoon.
And don't forget the neck.
I am using the Lashi only.
Yeah, you have to put that much and don't forget the neck. Most of us do this.
Can you spell
Neck
it?
keeps getting LA La Shield. And don't forget the back of your neck. If you're wearing like a thing and you're roaming around the sun, that's going to get tanned. Okay, all right, you were a lovely audience.
Thank you. Can you repeat the names of those creams?
Iga and Ugard. Okay, bye guys. Enjoy the rest of your. Okay, yeah, yeah.